What is tinnitus and why do you hear ringing? Tinnitus is the perception of sound in the ears or head when there is no external sound source. This can manifest as ringing, buzzing, hissing, or other noises. It is important to note that tinnitus is not a disease itself, but rather a symptom indicating an underlying issue, often related to the auditory system or other health conditions. The primary reason for tinnitus is abnormal neural activity in the auditory pathways. In a healthy ear, tiny hair cells in the inner ear, known as the cochlea, respond to sound waves. They send electrical signals through the auditory nerve to the brain, which interprets these signals as sound. When these hair cells are damaged, which can happen due to aging, exposure to loud noises, infections, or other factors, they may send random or distorted signals. The brain misinterprets these signals as phantom sounds, leading to the experience of tinnitus. Several common causes of tinnitus include hearing loss, which is often age-related or due to noise-induced damage to the cochlear hair cells. This damage disrupts normal signal transmission, resulting in tinnitus. Ear infections or blockages in the ear canal, such as fluid buildup or earwax, can also alter ear pressure and lead to tinnitus. Additionally, head or neck injuries can affect the auditory nerves or brain areas involved in hearing, often causing tinnitus in one ear. Certain medications can induce or worsen tinnitus. These include some antibiotics, cancer treatments, diuretics, and high doses of aspirin. Other health conditions, such as high blood pressure, temporomandibular joint disorders, Meniere's disease, thyroid problems, diabetes, anemia, and vascular issues, may also contribute to the onset of tinnitus. Tinnitus can be subjective, meaning it is only heard by the affected person, or, in rare cases, objective, which means it can be heard by an examiner through a stethoscope. The ringing or other noises associated with tinnitus are the brain's response to disrupted or abnormal signals from the ear or auditory pathways. Diagnosis of tinnitus typically involves a thorough medical and hearing evaluation to identify any underlying conditions. Management focuses on treating these causes when possible. Sound therapy, counseling, and hearing aids can help reduce the perception and impact of tinnitus. From the perspective of All About Hearing Loss, tinnitus is closely linked to changes or damage in the auditory system, especially hearing loss. Understanding this connection is key to effective management and support for those affected. If you experience tinnitus, it is essential to consult a healthcare professional for personalized advice and treatment options.